Receive an instant notification each time I upload a new report. Download my free notification app. Click the link in the production notes below this video. Thanks. Listen to this. On April 14, 2020, BeckerHospitalReview.com published a report on the state-by-state breakdown of federal aid that hospitals received for each outbreak patient. In April of 2020, Health and Human Services began distributing the first $30 billion of emergency funding designated for hospitals in the CARES Act. Some of the states hit hardest by the pandemic received less funding than states touched relatively lightly, according to an analysis by Kaiser Health News. The following is a breakdown of how much funding per outbreak patient each state received from the first $30 billion in aid. For its analysis, Kaiser Health News used a state breakdown provided to the House Ways and Means Committee by Health and Human Services, along with outbreak cases tabulated by the New York Times. Again, just to be clear, the following amounts are what hospitals received per outbreak patient, and this is in April of 2020. Alabama, $158,000 per case. Alaska, $306,000 per case. Arizona, $23,000 per case. Arkansas, $285,000 per case. California, $145,000 per case. Colorado, $58,000 per case. Connecticut, $38,000 per case. Delaware, $127,000 per case. The District of Columbia, $56,000 per case. Florida, $132,000 per case. Georgia, $73,000 per case. Hawaii, $301,000 per case. Idaho, $100,000 per case. Illinois, $73,000 per case. Indiana, $105,000 per case. Iowa, $235,000 per case. Kansas, $291,000 per case. Kentucky, $297,000 per case. Louisiana, $26,000 per case. Maine, $260,000 per case. Maryland, $120,000 per case. Massachusetts, $44,000 per case. Michigan, $44,000 per case. Minnesota, $380,000 per case. Mississippi, $166,000 per case. Missouri, $175,000 per case. Montana, $315,000 per case. Nebraska, $379,000 per case. Nevada, $98,000 per case. New Hampshire, $201,000 per case. New Jersey, $18,000 per case. New Mexico, $171,000 per case. New York, $12,000 per case. North Carolina, $252,000 per case. North Dakota, $339,000 per case. Ohio, $180,000 per case. Oklahoma, $291,000 per case. Oregon, $220,000 per case. Pennsylvania, $68,000 per case. Rhode Island, $52,000 per case. South Carolina, $186,000 per case. South Dakota, $241,000 per case. Tennessee, $166,000 per case. Texas, $184,000 per case. Utah, $94,000 per case. Vermont, $87,000 per case. Virginia, $201,000 per case. Washington, $58,000 per case. West Virginia, $471,000 per case. Wisconsin, $163,000 per case. And Wyoming, $278,000 per case. As at U.S. Law Review's legal man stated, quote, Those numbers are from April 2020. Imagine how much they've expanded this crap." End quote. This is Nancy Morgan Hart for Headlines with a Voice.